Welcome to Frontline News from the University of Maryland School of Medicine News Center. I'm Larry Roberts. Coming up, new research helps to explain age-related memory decline and why public transportation is so important for the health of older Americans. But first, School of Medicine researchers have published important findings about the COVID virus in the Proceedings of the National Academy of Sciences. Mutations in the spike protein enable COVID variants to evade the immune system. But School of Medicine researchers have discovered that other non-spike accessory genes also influence the severity of the infection.
These proteins are not necessary for viral replication, but they do influence the course of disease and the pathogenesis of the virus. So we've keyed in on certain accessory proteins like ORF3A and ORF8 for having a role in disease progression and in inflammation.
Researchers determined the function of these accessory genes by removing each gene and then observing the effect on COVID-infected mice.
So we take the full genome of SARS-2 and we delete a certain gene. So we delete the 3A, the 6, the 7A, or the ORF8. So what we found is when we delete the ORF8, you actually get more inflammation in the lungs.
I think one of the important things for us to work on in this virus is to study how these mutations really cause disease and affect pathogenesis. And so as new mutations are occurring, we see additional variants, additional mutations in each of these variants, and we are really trying to understand what each of these sets of mutations does. And I think what that tells us in the future is identifying new therapeutics that affect these pathways in particular.
Age-related memory impairment affects many older Americans, but there are no medications to prevent or reverse cognitive decline due to typical aging. Memories associated with social interactions are especially vulnerable.
I like to use the example of you go to a cocktail party and you meet a group of people. If someone came to you the next day and gave you a list of names, you'd be good at recognizing those people you met. If they gave you a picture of faces, you'd be good at recognizing the faces that you met. But where you'd start to have problems as you age is being able to associate that name with the specific face.
As a first step toward developing treatments, Dr. Kelly is using an animal model to mimic age-related memory problems.
Specifically, we focus on social associative memories. So again, kind of like our cocktail party, we want to be able to associate that name with a face. So in mice, they're able to effectively communicate with each other in an assay that is called social transmission of food preference. So in mice, they really avoid eating new foods because a new food could always make them sick or even kill them. So they're much more likely to eat a food that they have smelled on the breath of another mouse. And this is because they make an association between the non-social odor of the food and the social odors, the pheromones, in the mouse's saliva.
Dr. Kelly discovered that an enzyme called PDE11 increases dramatically in older people, especially those who develop certain kinds of dementia.
We wanted to test the hypothesis that if we prevented those age-related increases in PD11 from occurring, that we could reverse or prevent, in that case, age-related cognitive decline of these social associative memories. And indeed, that's exactly what we found. So when we deleted PD11 from the mouse's genome, if they aged up, those with the knockout, it's called, they were protected against age-related cognitive decline. So their behavior, their memory was just as good as a young animal's.
Dr. Kelly hopes that therapeutics can be developed to target PDE11 to prevent or treat age-related cognitive decline. School of Medicine research is shedding new light on the challenges older Americans face when using public transportation. The study found 20% rely on trains and buses to get to their doctor's appointments and other social activities. But for many older people, using public transportation isn't as easy as it should be.
It becomes a lot more challenging when we're talking about patients who either use wheelchairs, older adults who use walkers, older adults who might have some memory problems or mobility problems. Public transportation becomes much more challenging and dangerous for that population without the right safety infrastructure.
Dr. Falvey says the study can help inform public officials and policymakers on how to improve accessibility.
Accessibility starts with a neighborhood. You got to be able to walk to a station stop, and neighborhoods with broken and cracked sidewalks, our research suggests that older adults living there are 65% lower odds of using transit. And then we have to think about policy applications in terms of how are we getting people to these stops? Do we have the ability for the right assistive devices? Do we have caregiver training to help them get through the sidewalks? Do we have them help walk those several blocks that they need?
The study data was collected before the pandemic, which disrupted public transportation and further widened health disparities in urban areas. And that's Frontline News. I'm Larry Roberts. Thanks for joining us. We'll see you again next time.